After a night of drinking, long COVID could be the culprit for your longer than normal hangover if you've been feeling this at home lately. Research out of Stanford University shows there's a possible link between increased alcohol sensitivity and the SARS-2 COVID infection, otherwise more commonly known as long COVID. People tested say they felt worse symptoms of fatigue and headaches. Let's bring in Dr. Tom Pitts, a board-certified neurologist and good friend of the program, to weigh in on this one. Dr. Pitts, always good to see you. It's another issue we can add to the growing long COVID list, it sounds like. Help us make sense of this. I mean, physiologically, what would be the connection between long COVID and our tolerance for drinking?
Happy Monday, Markie. This is an interesting topic. And, you know, someone might look at this and say, like, nonsense, but actually there is a good scientific reason for this. And it's not limited to just hangovers, which we'll talk about. You know, after COVID, especially with this newest COVID-19, we see that it really confuses the immune system. It calls in pretty big immune responses. It damages tissue. It alters metabolism. And then we have the long COVID, which, of course, is not a long infection, but actually a long immune response. So basically, if you've had that, you're operating at a higher baseline inflammatory level, like we see in older people. They just have higher baseline inflammation. Also, you can develop alcohol intolerance, meaning when you drink, you have a much lower threshold to get the hangover. So if you drink your normal quantity, you really can be calling in a lot more inflammation because you're already inflamed. So think of it as throwing gas on the fire. You know, alcohol is a toxin, but most of us have some wherewithal to tolerate it in moderation. But if you've had COVID and you're already really inflamed, you're just going to have that much worse of a hangover, coupled with the fact that it also messes with sleep, which can further contribute to a hangover.
Yeah, I know you've shared with us if someone has long COVID, then any inflammatory response they have, be it the hangover, a menstrual cycle, gym soreness, etc., will just be exacerbated. If someone starts to notice their hangovers becoming more intense, but they're not changing up any of their drinking habits, I mean, is that a call your doctor problem, or is that just something to be cognizant of when we're out drinking?
Well, let me just preface that with saying, if you're drinking in moderation, right? If you're the guy drinking like a keg of beer or something, all right, that's just the alcohol, my friend. But if you are drinking in moderation, you're like, listen, I can't even have a cocktail or something like that. Yes, because that is just telling us. I mean, it would be the same as if you said, I can only play 10 minutes of tennis instead of 2 hours because my previous elbow injury is now so inflamed so quickly that it really prevents me from doing this, right? So I always take it out of the context and generalize it further. It could be anything. You know, I used to be able to run 2 miles. Now I can only do half a mile before I feel this massive inflammation and fatigue. So yes, and the way to deal with that is immunomodulation therapy, intravenous immunoglobulin, you know, antihistamines. These immunosuppressant or modulating medicines can help you then tolerate these things better by lowering inflammation.
And Dr. Pitts, more and more people are talking about the effects of long COVID. It's very much part of the conversation these days, and it manifests itself so differently in everybody. As a neurologist, what are your biggest concerns with long COVID and all the unknowns that come with it?
My biggest concern rests with the healthcare community, not the patients, because, you know, dealing in rare disease, I've just naturally been shuttled into this field as a neurologist. Guillain-Barré myasthenia. I mean, I've dealt with this for years. Actually, I came in contact with NewsNation through my work with COVID, modulating the immune system. My fear is that people are going to continue to treat this as if it is a virus, like an ongoing viral infection. It is not. The virus has left your system a long time ago. They need to really stop using things like antivirals to treat long COVID and rather focus on immunosuppressive therapy. The problem is many doctors have not had great experience with that. These are bigger gun medicines sometimes, and they feel a little bit gun shy using them, so patients linger in this kind of zone of you know, long COVID. Well, you're not dying, so there isn't an immediate kind of like threat to you, and people just live with years of agony, which will go on to cause sleep problems, which go on to cause arrhythmia, heart attack, stroke. So my fear is that we'll see earlier death because of it, because of kind of inability or unwillingness to treat it as aggressively as it should be from an immunomodulatory standpoint.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.